Okay, good morning. You all know that I'm Debbie Seymour from CSU Intensive Care Unit at St. Francis Hospital, but I am here today to talk to you about a disease that not only affects myself, but millions of women across America, and the disease is called endometriosis. It's a painful and reproductive immunological disease in which tissue similar to that which lines the uterus migrates to other parts of the body, attaches to other organs and grows, and wherever it attaches to those organs and grows, every monthly cycle when your uterus normally would shed and bleed, those lesions also bleed, so it's a very painful disease. Affects more than 5.5 million women in the United States alone, and over 70 million women worldwide. Continues to be stigmatized simply as killer cramps, very poorly understood disease. It's a leading cause of female infertility and chronic pelvic pain, and also gynecologic surgery. And it accounts for more than half of the 600,000 hysterectomies performed in the US every year. So what are the symptoms of this disease? Well, the first sign that a woman has endometriosis is usually pain, and women can go undiagnosed for years because the symptoms are very vague, they mimic other disorders. And in fact, the average time from first symptoms to diagnosis is currently 11.7 years. And that was done in a study by Hadfield, Marden, Barlow, and Kennedy in 1996. I guess they found out that the diagnosis time was extremely long. So the symptoms of endometriosis include pelvic pain, back pain, painful menstruation, pain with sexual intercourse, pain with defecation, urination, fatigue, immune system dysfunction, GI issues, infertility, and chemical sensitivities. So the diagnosis can only be made by a surgical procedure called laparoscopy. It's where a small camera is inserted into the pelvic cavity so that pictures of all the organs can be taken and biopsies can be obtained of the suspected lesions. And the lesions themselves can appear in many different forms, and it takes a very experienced surgeon to be able to visually identify them, so that means it's very important for them to be biopsied. What are the causes of the disease? It's actually unknown right now what the actual cause is, but it can include environmental factors, hormone disruption from pesticides and household chemicals, immune system fault or retrograde menstruation, and also genetic factors come into play. There's currently a study being done about genetic factors right now that I took part in last year, where my DNA was taken, and they put it in a big database, and they're trying to track who gets the disease compared to prior generations of their family. So the only treatment really right now that is effective is excision surgery. The disease itself is classified in 4 different stages, 1 through 4. Stage 4 being the most severe. It's usually an infiltrative disease, invasive against other organs, invades tissues, ovaries, pelvic cavity, the bowel, the bladder, and even the lungs, and has even been found in the eyes. The only treatment that is effective right now is the excision surgery, and that's where deep lesions are removed in totality. The traditional laser and cautery that they use right now only removes the disease from the surface of the lesions, which causes them to scar and doesn't remove the active disease from underneath, and it causes a huge amount of pain and can actually cause a woman to have worse pain after the surgery. So these excision surgery specialists now take a special laser where they remove very deeply into the tissue and remove all the disease, and they have found that that has a much lower recurrence rate. The way the treatments that are given right now is a drug regimen that is very ineffective. A lot of people will give synthetic hormones, which are ineffective and do not cure the disease. This disease is actually incurable. So the kind of drugs that they offer is things like Lupron or birth control. Lupron is actually brings about early menopause. It's a drug-induced menopause, and the side effects are quite horrific, and some of them are permanent. Other treatments include androgens, which are male hormones, which also cause permanent changes to the female sexuality, which is obviously not desirable. And birth control pills, but unfortunately birth control pills contain estrogens, and estrogen makes the disease worse because it's an estrogen-fed disease. So as you can see right now, the treatments that are on offer are very ineffective. The other most effective method of treatment is nutritional control, incorporating a whole foods plant-based diet as advocated by Diane Shepperson-Mills in her book Endometriosis, A Key to Healing Through Nutrition. She found that a lot of women should avoid things like wheat because wheat in the 1970s was modified to resist fungi, and therefore it became a hormone changer, actually affects your hormones, so that when you eat bread and wheat, it can make your disease process worse. So the most common surgical methods that are currently used are very ineffective, and a lot of women are told to have a hysterectomy, which is really a pointless surgery because endometriosis is outside of the uterus, not necessarily inside the uterus, although it generates from the uterus. So having a hysterectomy does not solve the problems. So you can see that that would not be an effective thing. There are only a handful of excision specialists in the United States, and many of them do not cooperate with insurance plans. So this leaves a lot of women having to pay out hundreds of thousands of dollars out of pocket for a surgery. Some of those women are very, very sick. They have multiple organ involvement, and they can't work. They're very disabled, and that's a big problem. Currently, I only know of 3 or 4 in the Northeast. And I myself had to travel to Maine for my surgery. So it's an ongoing problem. It's that the excision specialists are not widely known. So until this disease is effectively addressed and correct treatments remain available and taught to the doctors, millions of women will continue to suffer this devastating impact of the disease, and they will unnecessarily suffer pain and infertility and go years without diagnosis. And really it's a tragedy in this day and age that the treatment modes are so ineffective for such a disease that affects such a large amount of women. If you feel that you may have symptoms or know somebody that does, please visit my website, angryuterus.com, to find out more about the disease. Thank you.